My name is Rusty Crawford, and I'm a clinical oncology pharmacy specialist at the Southern Arizona VA Medical Center in Tucson, Arizona. We are affiliated with the College of Medicine and the College of Pharmacy at the University of Arizona, so we do have some academic affiliations there and at some of the other colleges of pharmacy within the state of Arizona. I've been a pharmacist at the Southern Arizona VA since 1988, so my whole practice career has been at that spot. Just this past year, I've become an active member in AVAHO in terms of the membership committee and in the research committee. And coming out of the research committee this year, we've got the first project that we've proposed that's basically AVAHO sponsored or AVAHO sanctioned, and it's a collaborative group with 8 total VA medical centers where we're going to be looking at adherence and outcomes in our male patients with prostate cancer on some of the new oral agents that have come out, because that's something that it's the big buzz these days. Is oral's better? It keeps our patients at home, but the downside of oral therapies is it's not observed. And it's not like when they come in for intravenous chemotherapy and I see the drug go into their port and I know that they got it. At home, we're just kind of saying, I sure hope Mr. Smith is taking his medications. And so this is an attempt for us to actually look at prescribing patterns and adherence rates to the medications, and to make sure that patients are getting their medications refilled, they're getting the proper monitoring. And then there's some other subsets of the study that we're going to look at in terms of demographic differences across the country, locations, proximity to medical centers, is that influencing prescribing practices, and maybe we're using some of these oral agents more out of convenience because of where the patients live so that we can get therapy into them. Then it might not be our first choice of treatments if they lived right next door to the medical center. So there's a lot of different components that we're going to be actively looking at. The biggest challenge, and hopefully this will go smoothly, is, historically we all have to deal with our own local IRBs. So even though this may be a group study that is being written by one provider that we're all having input on, we're all still going to have to go to our own local IRBs. Some IRBs are more friendly than other IRBs are. Some projects are easier to get through on your first or second try, and some take longer. Since we're still in the early stages of putting this project together, none of us have actually taken it to the IRB yet. We're not at that point in time where we're ready to submit it to the IRB. So I think that'll probably be one of the challenges. The other challenges are just we're all busy. And so for everyone to be able to sit down together at the same time of a day and have a phone conversation and say, what is it that we want to try and study? How do we want to study it? How do we want to report it? What do we think is significant and important to get out of this stuff? Just all of us having the time, because probably every time we have a conference call, there's at least 1 or 2 of us that are missing off the call. And so just to make sure that we're all on the same page, we're all kind of looking at it from the same, so that when we take it forward to our own individual IRBs, it'll go nice and smoothly. This deals specifically with veteran-centered care, and that's what we're all here for, is to provide the best care for our veterans. So I think it's important for us, because AVAHO is a relatively new organization, to show that we're kind of out there in front of things, trying to think of how to make sure that our patients are getting the best care, and that we're meeting all the standards that we hold everybody else accountable to, make sure that we're providing that same level of care. And you don't want to stereotype patients, but our patient population is a different population in terms of elderly, perhaps less education in their background, and so we want to make sure that we're giving them the best opportunity to benefit from the medications, and that they get the information that they need. Unfortunately, when you look at pills and oral medications, sometimes if we miss one, we just kind of shrug our shoulders. We go, it's just one day, it's just one pill. But we really don't know the negative consequences of that kind of behavior, and that's what we're hoping to find out from this, is do the patients that were adherent, compliant, have the right follow-up, are they the ones that are getting the best benefits out of the medications? And then we kind of know the message to send to our colleagues at all the other VAs is that adherence and compliance to these medications does impact outcomes in either a positive or a negative way for our patients. These medications have both been on the market for a couple of years. So what most of us plan on doing is just at the minute we start data collection, and we hope to be able to get this through IRBs and start data collection and reviewing records probably within the next 6 months. So once we can start getting that process done, our goal is to look at every patient who was on one of the two medications that we're looking at, either abiraterone or enzalutamide, which are the two new oral agents for prostate cancer. We're hoping to look at every single patient that had those medications prescribed to them. I think because we only have 8 medical centers that are participating, by the time we look at all 8 medical centers, I anticipate we'll easily have several hundred patients to look at data for, but at each individual medical center, I think the numbers will be relatively manageable. You know, for my medical center in Tucson, I'm probably looking at maybe 20 to 30 total patients. So the process of collecting data and reviewing medical records should not take that long for any of us to realize we're all kind of doing it with the rest of our daily responsibilities too. So I'd like to think by the time we meet at this meeting next year, we've already got some preliminary results that we can share with the membership. Because this still has not even gone to IRBs, if there's other sites out there that are interested in participating in this research, have an interest in getting involved in research within AVAHO, I think this is a great opportunity for others. I mean, the more numbers we have, the more useful that information is to everybody that we share it with. So I'd like to encourage people, if they're interested in participating in such a project, that they contact the chair of the research committee, who's also on this research project, and she'll be glad to send them the information and see if they're also interested in participating.